When you're keeping things clean, you should rinse all fruits and vegetables, rinse the top of the can. So when you're taking canned food, please make sure you rinse the top of the can, because if you are going to use a can opener, you are whatever dust or dirt is on the surface of that can, you will be introducing it into the can when you open it up. So before and after food, wash your hands properly for 30 seconds. Pay special attention to your nails and also the spaces between your fingers. Clean all your utensils and dishes with hot water and soap, and regularly clean the cutting boards and the kitchen counters also. Handling raw meat, you should be careful, because raw meat, poultry, fish, all of them, and the juices that come out of them can spread bacteria. So keep raw meat and their juices away from other kinds of food. And if you're using washing raw meat or poultry in the sink, make sure that the sink and the kitchen counters are disinfected after your job is done. And any items that you're using for preparing raw food, including the utensils, cutting boards, all of them should be cleaned properly. And it is very, very ideal to have separate cutting boards for your meat, fish, and chicken, and your vegetables. So keep your meat and fish separate and your vegetables separate. Have two cutting boards. That is ideal. And when you're cooking the food, also, you need to be very careful. Make sure that your food is fresh. Keep an eye on the use by date, the best before date. Make sure that your food is well within the expiry date. Always cook meat, poultry, and seafood to the right temperature. So it has to be completely cooked through. Especially when you're cooking for a patient who's undergoing cancer treatment, the foods should be completely cooked, including eggs. So I don't advise any runny yolk, any running white. The whites have to be set and the yolk has to be firm. Hard boiled eggs are the way to go. No soft boiled eggs or any bullseye or anything for a patient who's undergoing treatment. The egg has to be completely cooked in order to make sure that there are no bacteria. And after you've had your food, then storing the leftovers is very important. Leftovers have to be chilled promptly, especially ideally within 2 hours. And when it is hot like it is right now in summer, you have to be even more careful, because warm weather increases the risk of bacteria growing on food. And when you're thawing frozen food, once it's thawed out completely, it needs to be cooked as soon as it completely thaws. Do not leave it lying around for a long time. And again, food safety when you're going to a restaurant. So, ideally, for my patients who are undergoing cancer treatment, I advise them not to eat out at all. And I advise them fresh food that is made at home. But inevitably, if you're traveling long distance to take your treatment, or at one point or the other, you will have to go to a restaurant during your treatment. So, at that time, I always advise them to avoid any kind of raw foods. So, foods that we eat raw include salads or fruit salads. Please avoid any salads. This I'm specifically talking about patients who are undergoing cancer treatment, not the general population. So salad bars should be avoided. Buffet style of dining should be avoided, because this food has been kept outside for a long time and has come in contact with many people. Uh, Better to go for an a la carte option rather than a buffet option. Please go to restaurants that are clean and that are willing to prepare your food fresh and as per your order. So, a patient who is undergoing cancer treatment may not be able to eat a lot of greasy food, may not be able to eat a lot of spicy food. So, the restaurant should be ready to make the food according to your requirements. And of course, drinking water extremely important. Please make sure that it's adequately boiled before consumption. And if you're going to a bakery and buying stuff from the bakery, please make sure that it has been freshly made. So now, nausea and vomiting is a very, very common problem that is faced by most of the patients on chemotherapy. So you need to eat small, frequent meals. Avoid foods that have a strong odor. So fish curry or like the kayam, asafoetida smell from sambar, all of that may not be tolerable to a patient who is having nausea and vomiting because of chemo. So you avoid foods that have got a strong odor. Try and avoid drinking water during meals. Better to drink it before or after meals. And you may not be able to drink like a whole glass of water at one go when you're having a lot of nausea. So this is not only for people who are having chemotherapy, even those who are suffering from gastroenteritis, having a lot of vomiting. During that time, you may not be able to drink like a whole glass of water. Sip your water slowly throughout the day so that you get your adequate amount of water. Rest after you eat. And if you're having nausea in the morning, then Try and have some crackers or dry toast, or which may be helpful. And wear loose fitting clothing. So when you're having nausea and vomiting, better to avoid fatty or greasy fried food, avoid very sweet food, and very spicy and strong foods which have a strong odor. So this is my last slide. I just want to take the opportunity because September is our Childhood Cancer Awareness Month, and I'm very passionate about increasing awareness regarding childhood cancer among the general population. So I just want to give you some information regarding certain warning signs that everybody should know, because childhood cancer is a very rare entity. But
Slide is not visible. I think it's gone again.
okay, sorry, this slide is important. So
Yeah, doctor. Now it is visible.
okay. So yeah, these warning signs, please all parents make note of these warning signs, and do take your child to the local pediatrician if you feel that your child has any of these symptoms. In the first box, you can see a child who is very pale, who's having a lot of bleeding. Like bleeding can occur, daily bleeding from the gums, or they may have purplish bruises all over their body, or they may have reddish spots around their body. They may have a lot of bone pains. So younger kids, maybe 2 or 3 year old kids, may cry every time that they're picked up because of their severe bone pain. So these may be symptoms that are suggestive of leukemia. Lumps or swelling. So the second one is lumps or swellings. If you have a lump or a swelling, which is painless and which is significantly enlarged without any signs of infection like fever, then those need to be very carefully examined and need to be taken seriously. So, pediatric age group is actually the age for having numerous lumps. If you have a tooth coming out, if you have a dental caries, if you have an upper respiratory tract infection, in fact, even if you have lice, you can have small amounts of nodes, small nodal swellings in your neck. Other areas where these nodes are visible are in the axilla, that's the armpit or the groin area. So having small nodes in your neck is fine, but if you have multiple nodes which are more than 1 centimeter and which are not painful, please do take them to the pediatrician to get a checkup and make sure that everything is okay. Also, if the child has unexplained weight loss, persistent fever, persistent cough, all of that needs to be looked into. Eye changes is another very important factor. Normally, when we look into our eyes, the pupils, that's the center of the eye, is black in color. Very rarely you may see a whitish shadow behind the black part of the eye. Or like when you're taking a picture and the flash goes through, sometimes you can see redness within a person's eye, which is normal. But sometimes instead of the red reflex, you can see something called a white reflex, which is abnormal. So all these cases may be indicative of a tumor within the eye. Or if a child who has normal vision is suddenly developing a squint, or they're having sudden blurring of vision, or they're having some kind of swelling around the eye, all of that needs to be looked into. Also, be very, very careful of any abdominal swellings that you're seeing. Child's abdomen is looking very swollen, or when you're bathing the child, you feel that there is a lump within the abdomen. Please do take them for a checkup. Then headaches that are persistent headaches, very severe, mostly seen in the mornings as soon as they wake up, and the headaches that get relieved while after they have a bout of vomiting. These headaches may again be indicative of some amount of brain issues, or may even be a brain tumor. And limb or bone pain. So if they're having any swellings along their limbs without any history of trauma, without any infection, just a painless or a painful swelling in the limb, please do take the children to get a checkup at the local pediatrician. Make sure that everything is okay. So, as I said, September is the month for childhood cancer awareness, and the symbol for childhood cancer is the gold ribbon, which I have shown here. So, thank you. Thank you for your patient listening, and thank you to the organizers for giving me the opportunity to speak here today.
Ma'am,
Yes,
ma'am, I have a doubt.
yes.
Ma'am, I heard that when we have cancer, the hair will lose. Our hair will lose. Ma'am, why is that happening?
You don't lose hair when you have cancer. You lose hair when you take treatment for cancer. So, chemotherapy, the medicines for chemotherapy that we give to fight cancer, They fight against the cancer cells, but sometimes they fight against certain normal cells of the body also. So those cells include the hair cells and even your nails. So you can have hair or nail changes when you're taking treatment, but once the treatment is over, the hair will come back normally.
Oh, okay, ma'am. Thank you, ma'am.
Thank you, doctor, for helping us to understand various aspects of food safety. Thank you for your time and effort. Today, you led the session along with the Google also. Thank you for your continuous support. And already the time is over, so I am requesting all the participants to post your queries in the chat box so we can read it out and we can clear the doubts. There are some questions in the chat box. Shall I read?
One has asked regarding probiotics and prebiotics, safe to be taken. How often can we take it? And okay, so prebiotics and probiotics are good for improving digestion, like I had mentioned in the slide. There is certain normal amount of gut bacteria. So we have some good gut bacteria within the gut, which help to maintain the equilibrium within our gut and help in the normal working of the gut. So all these probiotics and prebiotics actually only help to maintain that gut bacteria. When we take antibiotics for any particular reason, or we take any kind of abnormal food, sometimes when you take a lot of processed foods, it can change the normal gut bacteria, and these probiotics and prebiotics will help to bring back the bacteria to the equilibrium. So it's probiotics are not, it's not really necessary to take them on a daily basis, but after you have like a bout of gastroenteritis, or you have like a really bad gut infection, or you've had like a prolonged course of antibiotics, these probiotics are helpful to bring everything back to normal equilibrium. So somebody has asked, what will happen with our blood if we have cancer? um, I'm not very sure about the question, but so a patient who is undergoing cancer treatment, they may, because of their cancer treatment, the cancer drugs will act against the cancer cells. And like I said, it can act against certain normal cells of the body also. So in some cases, it can affect the bone marrow of the patient and lead to decreased blood production. So, because of the decreased blood production, the patient may require, if it is very severe, they may require transfusions. You may require platelet transfusions or RBC transfusions. When our WBCs fall, the white blood cells in our body, when they fall, that is when the patient has an increased risk of developing infections and they become immunocompromised. So that is when we need to be very careful about food safety, about hand hygiene, about restricting visitors and reducing the amount of exposure to infectious agents in that patient. I hope that answers your question. What medicine will we have when we have cancer? That depends on the type of cancer, but we have a number of chemotherapeutic drugs which are given in different combinations depending on the type of cancer that the patient have. And not all cancers require chemotherapy. Some may only require surgery, some may require surgery and radiation, some may require all three. So it depends on the type of cancer that you require. Any correlation between current food practices, lifestyle, risk of cancer, such as added colors in food? In the short term, no. So if your child is having, added food colors in the food and all, it probably won't cause cancer in the childhood. But our general health is affected by these kind of food practices. And in the long run, for us as adults, it will definitely affect our health. So food practices and lifestyle is very important. Like I said, obesity is like a growing phenomenon in our current society because of the various amount of processed foods, the increased access to junk foods. During COVID, there was a lot of restriction regarding the amount that the children could go out. So, and of course, social media, the use of phones. Because of all of this, our children are getting more and more sedentary, and there is an increase in obesity. So, like I had shown earlier, obesity is actually our biggest risk factor right now for cancer, as well as a lot of other problems. Obesity can cause increase hypertension, increase incidence of diabetes. Diabetes can affect every organ in your body. It can affect our heart condition. It can affect the quality of our blood vessels, leading to increased stroke. So really, obesity is the one that you need to avoid. How many types of cancers are there? Uh, there are many types of cancers, but with respect to childhood cancers, we can divide them into two types. So one is the hematolymphoid cancers, that is those that affect blood and the lymphatic system, including the lymph nodes, and the other is the solid tumors. So the solid tumors are tumors that are like they're called solid tumors because they are cancer masses. So these masses can occur at any point of our body. Any part of the body can be affected by cancer masses. But the hematolymphoid is mainly blood cancers and cancers involving our lymph nodes. So will there be any changes in our veins or any part of our body? Are you implying when you have a cancer? Yes, depending on the type of cancer and the position of the cancer, there can be a change in that part of the body. Cancer is mainly when our the cells within the body start growing abnormally. So every cell divides, and a cell divides, it grows, it dies, and it is shed. That is the normal cell cycle. But certain cells may have some amount of changes within them, which causes them to grow exponentially, abnormally, and they may not die and they just keep on growing. And that is when you actually develop a cancer. So, definitely, yes, there will be a change in the part of the body when you develop a cancer. If do we have blood test if we have cancer? There are various blood tests that we do if a doctor is suspecting that a patient is having cancer. There are a number of blood tests that are done to confirm that, especially in the case of leukemia. So if the doctor is suspecting that you may have a blood cancer, there will be a various number of blood tests that are done, including something called a peripheral smear, and we will do bone marrow tests also in order to confirm the type of cancer that the patient has.
Excuse me, ma'am, I have a question.
Yes.
Ma'am, does the body started when we have cancer? Do our body starts to be cold?
Not necessarily. The temperature of the body and the presence of cancer, there is no like serious.
Oh, thank you.
What things should we eat if we have cancer? Okay. So, if you're undergoing cancer treatment, it is ideal to eat healthy food which has been freshly prepared, and it is best to avoid any kind of processed food. So, I always advise my patients that they can eat all kinds of food, but it has to be cooked food. So, no raw food, no salads, no uncooked vegetables, no actually at sometimes depending on the type of cancer and the severity of immunocompromise that I'm expecting the patient to have, sometimes I even tell them not to eat raw fruit. So I always ask them to slightly steam or lightly cook the food before eating, whether it's fruits or vegetables, or they can have any freshly kind of foods. Some foods I do ask them to avoid when they're having when they're undergoing treatment, because um, like shellfish, certain amount of shellfish can cause gastroenteritis if it's not cooked properly. If you're having prawns or clams or anything like that, either one of them is not proper, you can have a very bad gastroenteritis. So because of that, I advise them to avoid shellfish, and I ask them to avoid ice cream also, because again, it's a matter of maintaining the temperature. If there is a lot of temperature fluctuation in the storage, during transfer of the ice cream to your home, when you're defrosting your own freezer, all of that can cause buildup of bacteria within that. And for a patient who is immunocompromised and whose immunity is very low, even that bacteria can cause a lot of problems. So these I do advise. Could you explain the role of diet in loss of appetite during growing age? Explain the role of diet in loss of appetite during growing age. Oh, okay. I think okay. Most kids, yeah, don't don't they have a lot of problems eating when they're, yeah, I get it. Many kids have a lot of difficulty eating fruits and vegetables. They may have a lot of, they may be very picky eaters. I have two picky eaters at home. I think the best way to go is probably try and pick healthy options, give them a number of choices, and so that they can choose. If they try a lot of things, there may be something in there that they do like and that they will eat. And again, maybe they may not eat three large meals. They may prefer to eat smaller meals at regular intervals. So maybe instead of giving them three large meals, maybe break it down to five smaller meals. So in these ways, we may try and increase the amount of food that the children eat at home. Are we doing normal surgery or plastic surgery? Okay. So cancer surgery is different from normal surgery. Ideally, cancer surgery should be done by a surgical oncologist, not a general surgeon, because the principles of cancer surgery is different. But yes, we are doing normal surgery in case of a patient. In case like if it's a head and neck cancer, or if it's a breast cancer, and you're removing a large part of that area in order to save the patient, then some amount of plastic surgery also comes in, because if the patient is having a large tumor in the cheek and that has to be removed, then they will place a flap in that area. The plastic surgeon will come and reconstruct that area in order to improve the aesthetic look. Similarly with breast cancer also. So if it's a large breast lump and they're removing it, that area can also be reconstructed by the plastic surgeon as part of treatment.
So it was a nice interaction section.
Thank you. Thank you for the opportunity to speak here. It's been a great time.
Hope the questions are over.
I have one more question. We can't
One
eat
more
storage
question.
food. Yes, you can eat stored food or leftovers can be eaten. Ideally, for my patients who are undergoing treatment, I advise them to eat fresh food and not stored food. But even if you're having leftovers, they have to be stored properly. They have to be stored early. Like, don't leave the food outside for more than 2 hours before freezing. And if you have before freezing or keeping it in the fridge, and do not eat food that has been kept in the fridge for more than 2 or 3 days. So these ways, I do ask my patients not to. I would advise the parents to give them freshly prepared food daily. But of course, it's not always possible to make fresh food for that child every single day. Depends on how busy the parents are and what resources they have. But ideally, yeah, I would advise them to eat fresh food on a daily basis. Which things should we eat to avoid cancer? So, like I said, there's been a lot of speculation in media regarding, whether there is any food that you can eat so that you don't get cancer. Unfortunately, they have not been able to find any correlation between eating a certain food and not getting cancer. So there are foods that reduce your risk, but it doesn't mean that if you eat it, you definitely will not get cancer. There are foods which are high in antioxidants. There are foods that are rich in phytonutrients. So all our colored fruits and vegetables are high in antioxidants. Our foods which contain allium, like onions, garlic, fruits, nuts, all of these are good for reducing your risk of developing cancer, but it doesn't mean that you stick your diet only to vegetarian. I mean, just to avoid cancer, it doesn't mean that you only stick to vegetarian food or that you only stick to eating colored vegetables. That is not going to help you. The ideal thing would be to maintain a good body weight, have a good lifestyle habits like regular exercise, drinking plenty of water, and what is very, very important is to have a balanced diet. The balanced diet is your best bet against cancer or any sort of diseases like hypertension, obesity, cardiac diseases. All of that is mitigated by following a healthy lifestyle.
Thank you, Doctor. Thank you all for the nice interaction and participation. We know your busy schedules, and respective of that, you took that effort in order to make us to understand various aspects that is very much beneficial for our kids. Thank you so much, Doctor, for all your effort. I welcome Grandmaster Tirtha Vivek for a vote of thanks.
Good evening, all. I'm Tirtha Vivek. I'm so happy to express my sincere gratitude on behalf of OFSSA to Film Actor Sri Gogol Suresh and Dr. Sveda Sitaram for providing us with the valuable information on recommended food safety practices and childhood cancer. I also would like to thank all of the national and state leaders and coordinators for organizing this national webinar. The success of this webinar is definitely the participants. I thank each and everyone joined in the national webinar and I request your continued participation in all upcoming webinars. Let our webinar series to be the milestone to build our nation healthy. Vande Mataram, Jai OFSSA.
Once again, thank you, Doctor. Thank you all who participated here and for the lovely kids who made this day most beautiful and successful. Thank you for the interaction. Thank you. I thank all of the national and state leaders as well as of the webinar coordinators.
All of the national and state leaders and coordinators for organizing this national webinar. The success of this webinar is definitely the participants. I thank each and everyone joined in the national webinar and I request your continued participation in all upcoming webinars. Let our webinar series to be the milestone to build our nation healthy. Vande Mataram, Jai OFSSA.
Once again, thank you, Doctor. Thank you all who participated here and for the lovely kids who made this day most beautiful and successful. Thank you for the interaction. Thank you, Doctor, for your time. I thank all of the national and state leaders as well as of the webinar coordinators. Webinar coordinator from Karnataka, Sujya Srikanth, and from Tamil Nadu, Praveshika, and from Kerala, Mausmi. I thank each and everyone participated here and for coordinating this. Thank you all. And we are very happy to announce that our next national webinar will be on September 9th, 7:30 p.m. We are expecting your continued participation. Thank you all.